Hi, everyone. Can you hear me now? I hope so. So my name is Laura Abrams, and again, I'm a professor at the University of California, Los Angeles, and my research interests have to do with juvenile justice. What I wanted to talk about today is thinking through some of the research evidence and the base that led us to this work. Can you scroll back just one slide? I wanted to acknowledge my research partner, Dr. Barnard, who is a pediatrician at UCLA, and the bulk of this work we've done as a team. Next slide, please. Many of you are here because you're concerned about the criminalization of childhood and the devastating effects of the trajectories of the juvenile legal system that create difficult conditions for youth to thrive and that are also laden with racial disparities and racism. Some of these stories you probably heard about in the last year or two. The folks who are young, under 12, the one in a young lady in Rochester, New York, who was 9 years old, pepper sprayed and handcuffed, other children being beaten in schools by school resource officers who are just 5 years old and such. We have a clip here on the side of the screen with our Washington Post editorial that came out a few months ago to talk about why we need a minimum age of juvenile justice jurisdiction across the country and not just in individual states. Next slide. When we started to get interested in this topic, we realized that there was a strong emotional and value-laden appeal to keeping children out of the youth justice system, but there wasn't a lot of research. So we started from the premise that children are different from adolescents, not to say that adolescents either belong in the juvenile legal system, but in the beginning of our inquiry, we started thinking about why are children criminalized? And we focused on children under 12 at the beginning. And the reason that we saw was that children often lack the cognitive skills for capacity and also for competency to benefit at all from justice processing. In other words, it's not the place for children in a court. We saw research that showed that diversion is likely a better alternative, but diversion is also net widening and can lead to inadvertent contact with the system. And we also noted stark racial disparities, even at younger ages of the juvenile legal system, and that the UN standard was raised to 14 in 2019 for a minimum age. So what we did was we realized quickly that there was not a strong research base on the minimum age laws. And we're in the state of California, where when we started, California had no minimum age law at all. So we looked at data and we saw that children even as young as age 5 in California were coming into contact with the system, which we were shocked by. So the first thing we did was we were trying to establish a research basis to push along this legislation. Along with Dr. Barnard, we analyzed data from the National Longitudinal Study of Adolescent Health, the AdHealth data set. And we did find in a series of papers that adults who have a history of child incarceration, in this case under age 14, were disproportionately Black or Hispanic, according to the way the data were coded, male, and from lower socioeconomic status. That's not surprising given what we know about the system, but what we also were able to show is that those who had been incarcerated as children had worse adult health outcomes in terms of general health, functional limitations, depression, and suicidality. So while this study wasn't causal, we were able to see there were correlations. The other thing we did was we recognized that the data show one picture, but we didn't really understand what is happening across states. So why do some states have a minimum age law, and why didn't other states have a minimum age law? And then we also realized that the minimum age laws ranged from 6 to 11 at that time when we started to do the study, and very few were at 12, or none actually at that time. So what we did to try to convince California that this would be an advantageous law for the state was we did a legal analysis of these laws. And we also analyzed juvenile court data, and we conducted a bunch of stakeholder interviews as well with law enforcement, probation, judges, DAs, and public defenders. And what we found, the next slide, is that across all 6 states, stakeholders tended to agree that the juvenile legal system, and especially incarceration, is not suited for children. So people tended to agree with the principles that the system should protect younger children. We also found that states that had age thresholds in the law, those thresholds had been there since the beginning of the state constitutions. They didn't know why they were there. But in general, if a child under that minimum age threshold had an offense, so to speak, it just wasn't considered an offense. And that sometimes that child was referred to other systems when needed, but they just weren't prosecuted. Now, for states that are just considering how do you implement a minimum age law, this was very good information. So California, the main question that came up was, well, what do we do in the meanwhile, right? What do we do with a young child? So we had some examples from other states to share. And so we were able to answer some of those questions. The stakeholders we interviewed talked about minimum age laws as having more fairness and less discretion, and the drawback being the potential for net widening in the sense that child welfare or mental health being involved wasn't necessarily better than the juvenile legal system. So that's just a snapshot of the research. This research was used to create a series of policy briefs that went to legislators and eventually helped pass the California minimum age law of 12 that went into effect in 2019. So next slide. So we still have work to do, which is why we are now working with this National Juvenile Justice Network. We know that the United States still has no national minimum age law. We know that we're an outlier still in the way that we treat and confine and prosecute children and adolescents, and that the UN is now recommending a minimum age of 14, and the US is nowhere near that in terms of where the states are or the feds. However, on the next slide, we also know that the momentum for this work is really growing, and that in 2015, we were at a very different picture than we are in 2020, where now we have 3 states that have a minimum age of 12, we have some that have 11, and many more states that are considering passing minimum age laws, hopefully in part due to the research that we've been developing, and of course, all the advocacy that's taking place in individual states. So I will turn it over to Melissa.
Great, thank you so much, Laura. So just wanted to show the momentum this year in 2021. There were approximately 17 states or territories working on raising the minimum age of either jurisdiction or confinement. And you can see on the slide several wins, Connecticut raising the age from 7 to 10, and Maine raising the age of detention to 12, Mississippi raising the age of commitment to 12, and North Carolina raising the age from the very low of 6 to 9. Still a little work needs to be done there. And still pending is legislation in Delaware and New York that we are hoping will pass this year that would raise their ages to 12, which would be great. So we urge you to join our campaign. Dr. Abrams, as well as Dr. Barnard from UCLA, started a coalition, which NJJN is now facilitating as well. And we meet monthly on the third Friday of the month. So feel free to email myself or Allison Clements if you'd like to be added. And we're happy to share a wealth of resources with you. And I've also hyperlinked to our webpage with additional resources. And in terms of the issue of police-free schools, which you'll hear about today as well, momentum is also growing in this regard. We know that Black and Brown students and families in particular have been working on this issue for years. And there has been a lot of progress recently, especially since the tragic death of George Floyd in 2020. And I've listed there many jurisdictions that have in the past year or two removed police from their schools, which is very exciting. And here is just a quick visualization of how we're kind of tying in all these three issues today, that by reducing the criminalization of children, both through raising the age of jurisdiction and removing school-based police, these are all ways we can actually improve children's mental health, because we know criminalization is very harmful to their mental health, as well as, of course, providing accessible community and school-based mental health supports. So let me stop sharing my screen now. And I'm going to turn it over to Sana Fadel and Marissa Garcia, who are going to talk a little more about the issue of raising the lower age, which they did in Massachusetts.
Thank you, Melissa. And good afternoon, everybody. Thank you all for joining us today. My name is Sana Fadel. I'm the Deputy Director at Citizens for Juvenile Justice, which is a statewide advocacy organization here in Massachusetts. We advocate on behalf of young people who are either involved in or at risk of legal system involvement. So our target population are those from birth until the mid-20s. In July of 2018, Massachusetts became the first state in the country to have the lower age of jurisdiction to be age 12. That law passed April, took effect in July, and one of the things we're very proud of here in Massachusetts is that there are no carve-outs in this law. It's just flat out raising the lower age. And I hope if we have time, we can talk about more, so like the arguments about why we want to have no carve-outs. But what I'm gonna focus on is sort of like our advocacy, how we got to where we are today, as well as sort of like the issues that have come up in the implementation in the past 3 years. And hopefully Marisol will follow, talking about like actually the work that she does and sort of the implementation at the statewide level. So this work started around 2015, when we, as our coalition, as Naomi mentioned in my bio in the beginning, we have a statewide juvenile justice coalition. And in 2015, we decided that this was going to be the session we are going to be advocating for a comprehensive, like an overhaul of our juvenile justice system. So not just one issue area, but all of the areas we were advocating on one big omnibus bill. So that bill looked at preventing entry. So raising the lower age was one of the under the packet of reducing legal system entry. We also looked at harm reduction and equity and transparency. So it's a pretty big bill that we were trying to pass. So that was one of the drivers. And we identified raising the lower age at that point. I wish we had Dr. Abrams' research back then, because sort of like we sort of knew it in our gut, but we didn't have the data and the science. So that was great. But our legislators were able to move forward with what we had. And at that point, we actually originally filed a legislation to have the floor at age 11. And then when we looked at the UN Convention on the child rights of the child, what their recommendation was age 12, we said, you know what, that's where we should aim. So we identified age 12 as our lower line. And part of it was that it's, again, as an advocate, I'm always thinking like, how do I talk to legislators about this? part of our messaging was we want kids who are typically in the elementary school age out of our legal system altogether. That was part of that was actually helpful in our advocacy around messaging. We had a little bit of data. We didn't have a lot of data because the number of young people from 7 to 11 at that point was between 120 and 160 kids per year. We didn't have the extensive analysis that Dr. Abrams had. So we tried all sorts of arguments around competency. We looked at reading levels, which actually something, an advocacy strategy we stole from the folks at the advocates in Nebraska who looked at reading levels, which was really amazing, an advocacy tool talking about does someone who think Captain Underpants is classic literature, is that the same person, same age as someone who should be in our legal system? We looked at the data and the profile of our young people. And of those, like I mentioned, between 120 to 160 kids were being arraigned in courts each year. Most of them were arraigned for assaults. So they got into fights, public destruction, or public order offenses. At that point, we did not have school-based arrest data other than what was sent to the federal government, which was unreliable. It's actually one of the things we were able to also pass in that package requirements around school-based arrest data. But looking at the arrest profile, we assumed a significant number, at least a third, if not more, were school-based arrests. So part of it, we looked at, there's all this whole piece around school-based arrests, the use of police officers in school. All of that was not part of our toolbox at that point. We didn't have that information at that point from the 2015 to 2018 advocacy time. But we knew that schools were using law enforcement as a disciplinary tool. And that was part of our arguments that is also ensnaring these young, very little kids. The argument that really won the day with legislators was the issue of competency. So what we know is, there's extensive research on competency for kids. So competency, I'm an attorney, so the way I explain it is, when you go into court, will the kid know the difference between a judge and their lawyer and a prosecutor and a probation officer? Do you know when you say for a jury trial or not jury trial, do you even know what that means? So the basic functions of a legal system, will the young person be able to assist in their own defense or be able to work with their own attorney to defend themselves? And the research shows that, from the ages of 11 to 13, there's really poor understanding of trial matters. There's poor reasoning, poor recognition of information relevant for their defense. And what we were able to find with this competency, the reason that it helped is that actually lack of competency means that juvenile system involvement actually delays a young person's accessing services. So for example, the worst thing that can happen, a young person goes into court, they're not found to be competent. The worst thing they'll say, okay, you know what, this is something bad happened, we're gonna hold you in detention. If you're held in detention in our Department of Youth Services, you really don't get much services. You have to go to school, you get emergency services, but none of the treatment, none of the services that people say, oh, we can connect you to services. What happens is every 6 months, that young person gets evaluated. So they're either going to be facing delays in their court case, whether they're at home. If they're detained, it actually their condition will actually worsen because they're disconnected from school, disconnected from family. And it's just worse outcomes if they're detained. But whether they're in or out, there's delays in the court case until the case can proceed. And that typically can take several years until the court can find a young person guilty. So you do something at age 9 or 10, you're now 13 or 14, now we can proceed with the case. That's a long, long delay. When a lot of the arguments as well, young people did something, we need to hold them accountable. So what we said is, if you want to connect them to services, prosecuting them delays that because they have legal rights and due process. The court can't do anything. You also can't get resolution and accountability because it's going to take several years before a young person is found delinquent or not delinquent, and then say, okay, now we're holding you accountable. The other thing we also talked about was the fact that we already have an extensive and hopefully growing child serving system that's outside of our legal system that is better suited to work with young people. And one of actually key allies in this work was the commissioner of our Department of Youth Services. When asked about this, he actually said, like, I don't want them that young. The DYS actually set up an entire foster care system so that young people who are detained don't actually get into a locked facility. They're in a specific specialized foster home created just for the smaller population, which now we use for a different purpose, but not for little kids. And what he said, the commissioner said, is the older they get to me means they're delaying legal system involvement. It's actually, I have a better chance of working with them to get them back on the right track. So one of the things that also some of our, what we would call opponents, and I think Dr. Abrams mentioned this in her slides, that everybody agreed of the goal of we don't want young people in our legal system. We want to delay young people coming into our legal system. Where we actually found disagreements is, well, what do we do instead? How do we hold them accountable instead? And our argument has been, for most young people, you actually don't need an intervention. They did a legal system intervention or a formal response. So for example, we'd mentioned that a significant portion were school-based arrests. There are ways for schools to deal with young people. Sort of like, schools are their own, they're not their own government, but they sort of for like, 6 hours a day, you're really an authority of everybody in this building. You have the tools to intervene with young people. For other interventions, what we saw is most young people who behave similar ways don't actually get arrested or involved in the legal system. We normally find other behavior for kids that age, if they're white, if they're privileged, if they have, whatever privilege they have, they behave similarly to those children. The only difference is who says, well, this is a crime and this is not a crime. So for a lot of that bias against young people can be solved just by doing nothing and just doing what most adults do to most other children. Then there's a chunk of children for whom court involvement is actually a symptom of underlying needs for support, where for them, community-based services are more effective and timely. So by raising the lower age in Massachusetts, for everything, we actually removed prosecution, which was a barrier to receiving those services and not a way to compel, which was what the opponents were saying was, when you have the threat of prosecution, you can compel a child to get services. But it actually, in reality, was actually acting as a barrier. So for example, if I identified my child has this need, but if I ask for help, my child may be tagged because they've identified a crime. I don't want to risk that. They're gonna go into an adversarial legal system. So I want to make sure my kid does not get prosecuted, does not get found delinquent, all of those things, rather than saying, oh, you know what, by removing that threat, I'm much more open to say, okay, I need help with my kid, and I can open up asking for services. And I'm just gonna move on to the implementation. July 2018, the legislation passed. The law, again, I said there was no carve out, but the other thing that also law did not specify is an implementation plan or any kind of requirement. And I think that was really helpful here in Massachusetts, because we weren't tied to, well, you can do this only if you do that, which I believe a lot of states are facing that challenge in their advocacy. Massachusetts, we did not have that. And I only mentioned this because I think as other states are considering this, this is a viable way of doing it. Raise the age, no carve outs, and an implementation plan is not necessary for this to happen, especially if you have a pre-existing child serving network, which I believe most states do. We do have barriers like access to mental health services for children, wait lists, all of those exist in Massachusetts. We don't have like a perfect child serving system. However, we looked at, well, what is already there and how can we use it for those kids who do need specific services? So one of the other, so I'm going to talk about I have my last 2 points. So one is around sort of this argument of compelling services. So right after implementation, we we had the law also created what's called the Juvenile Justice Policy and Data Board. We have a bunch of stakeholders, government, non-governmental, different levels of government, different branches of government, all together, and it's a permanent board where we discuss these issues. And one of the first issues around implementation was like, especially from the law enforcement side of that table, well, how are we going to hold young people accountable? Now we can't arrest them. Now we can't do this. And we don't really want to arrest them. What we want to do is we want to make sure they're connected to services. We want to be able to file a child requiring assistance, which I believe in other states called CHINs or PINs. And we're like, no, we do not want police filing that against children. We want to be able to find a way to go, have them still go to court, but they don't get a record, but they still have to go to court to force them. And the consistent language we heard was this language of pathologizing parents. And I was like, well, it's not really because we want the kids, but honestly, it's because we need to step in because the parents will not step in. And our counter argument is if the parents are not stepping in, it's probably our theory was on one of two circumstances. One is they've been knocking on those doors for years and they haven't been able to access that. And they've been turned around consistently. And now what you're saying is the court is going to force them. And if they're still unsuccessful, but without providing the supports, because courts cannot force service, they can't force services to open, doors of service to open. They just say, if you don't do this, there's the sanction, either I guess the parent or the child. Or the parent was like, I need to protect my child and I have to weigh the harms of getting services for my child if this comes out versus actually getting them services. And our argument has been, and sort of that language of pathologizing parents was consistent among our opposition to say like, well, we don't want to really harm kids or arrest kids, but really the parents are the problem. And I just want to caution you that has, in our implementation, we had to push hard against that language. And I just want to end with just an example of some of the services, an example of how we used pre-existing services. So in 2010, 2012, I forget the exact year, we overhauled our truancy system, what was called CHINs, now it's called child requiring assistance. And part of it was we want to get kids out of our juvenile justice system, our our child welfare system and our truancy system. And part of implementation was creating these family resource centers across the state. The original family resource centers were actually, prior to that, they were a pilot and their history was to prevent child welfare and juvenile justice involvement. So that was in its inception. So after the CRA reform happened and after raising actually a lot of the reforms in 2018, there's been an investment by the state on these family resource centers for just keeping families out of our legal system altogether. And that's been something we've been able to rely on. And Marissa will talk a little bit more about that. But that's not the only implementation strategy, but that's one of the biggest ones. So I'm gonna take a break now and hand it over to Marissa.
Thank you so much. Senna is definitely a force in our state, and we're so incredibly grateful to have her here. I mean, the things that she talked about were not easy tasks, and she is a Hercules. Okay, so I'm just going to share my screen quickly so I can just show a little bit about some of the things Senna was talking about, and I'll go through these slides really quickly, I promise. So you guys can see this? Great. So I'm Marissa Garcia. I'm the Senior Director of the Mental Health Advocacy Program for Kids. And I'm one of the diversion programs that Senna was talking about. What she was saying is that in our state, this is Massachusetts, in case you guys don't know what Massachusetts looks like. This is Massachusetts, and our program is a statewide advocacy program. So if you look at where the stars are those family resource center that Senna was talking about. When the legislature originally created them, there was one in each county. Most counties now have 2 and some counties have 3 according to population. The stars are where the family resource centers are, and then the darker stars are where our attorneys are based out of. So our program provides free legal representation for families that are trying to navigate the treacherous waters of special education advocacy, insurance coverage, and accessing services from state agencies, like someone said in the chat, without having to give up custody of your kids. So these family resource centers were created by the legislature in 2012, and they already have a full staff there to try to divert kids from the child welfare and juvenile justice system. And they do a lot of really cool stuff. They have parenting classes, they access with benefits, they make referrals to mental health services, and they have one of our attorneys right in that milieu. Our collaboration with them is we actually do direct legal representation of kids who need to access mental health services. We do legal consultation with the clinical staff that's there around families that are having barriers and to accessing mental health services, and we do legal trainings and information. So the bulk of our actual legal work is around attending special education team meetings to advocate for eligibility for services or improved services, seeking eligibility and services from state agencies like the Department of Mental Health or Department of Developmental Services, advocating for diversion from the juvenile justice and child welfare systems, and ensuring that families have access to health insurance and health insurance coverage. So we get a lot of our referrals actually from the court system. That is our biggest referral source. Our second one is the family resource centers themselves, and then you can see the rest. We represent families that are income eligible, and we all families have to have a mental health access need. We all know that 80% of the kids who are involved in the justice system meet the criteria for one mental health diagnosis. So this is a huge need for us. Initially, we were in the juvenile justice system, and you can see the numbers that change between the pilot and our current program. We are currently serving kids who are a lot younger. We've had kids as young as 3 years old in our program, all the way up to age 22. Since leaving the juvenile justice system, our numbers for more accurately reflect the communities that we're in. We have kids who have been held back or disciplined a great deal in school. That's something that we see. A lot of kids have been suspended or have been sent home from school for mental health needs that are unmet in that setting. We know that kids have high rates of truancy that are sent to our program, many of them missing more than one day of school, or 15% missing every day. These are kids who are involved in the juvenile justice system often. 62% of them had open court cases when they started with us, and with the largest group of them being child requiring assistance cases, or as SENA called, in other states, those are called CHINs, FINs, what have you. Our kiddos are, 97% of them have at least one mental health diagnosis, but often they have more than one. And many of them have been psychiatrically hospitalized. The rates of psychiatric hospitalization are really large in this group. It's around 48% of them have been to the emergency room. Other crisis interventions are very high among our group. And they're being sent to us for access to mental health services and access to special education services. Because as Senna indicated, we're really seeing a lot of barriers to mental health care. 98% of kids, 98% of families reporting at least one barrier to care, the largest one being bureaucratic delay, which all of you guys will recognize as difficulty navigating paperwork and eligibility processes for different services. And, incomplete information being the second largest group, which is where to access services and how to access them. And that's how, when folks ask us, why do families need attorneys to do this? We all know why. These are systems that are siloed, completely entrenched, and difficult to navigate, not the least of which is systemic racism, which makes it harder for families of color to access and navigate all of these systems. This program has been really effective in dramatically improving school attendance. I told you that a lot of our kiddos have been difficulty attending school. That improved. We saw decreased use of emergency mental health services, dramatically decreasing inpatient psychiatric hospitalizations, with kids reporting that their mental health improved, with parents indicating that their mental health of their children has improved and that their own mental health has improved. We see more kids in school, in their communities and at home, and less kids in detention or involved in the justice system. So I'll stop sharing. I know that was pretty fast, but I'm kind of aware of the clock, but I just wanted to make sure that we gave a quick overview of the work that we're doing here in Massachusetts.
Yeah, thank you both for covering how you both changed the law, but also sort of better structured the system so kids could get access to services sooner. I know Sana sort of mentioned this piece around school-based arrests making up a large portion of those coming in from younger kids coming into the system. And so we're going to sort of shift to focus on police-free schools because we feel that's another policy that we can enact to put a barrier for kids going into the system. So I'm going to attempt to unspotlight you guys and move over to Jasmine and Kenneth. So give me just a second and we'll figure this out. Got one. Get the other. Welcome, Jasmine and Kenneth. Do you want to take it away?
Great. Yeah, thank you so much. Good afternoon, everybody. Once again, my name is Kenneth Avon, and I am the Executive Director of the Advancing Equity Coalition here in Minneapolis. As was stated before, our mission is to develop the political will to eliminate institutional racism in Minneapolis public schools. And in my previous role is actually where I did a lot of work in advocacy around removing police from Minneapolis public schools and really ending the contract between Minneapolis public schools and the Minneapolis Police Department. And so just to set the stage and really to ground us in what was happening in Minneapolis public schools, I want to share this slide with some data. As you can see here, the gray bars over the course of the course of the 2018, 2019, and 2020 school year, we can see the gray bar represents the percentage of students in Minneapolis public schools by race. And so you can see American Indian, we have 4%, or 4% of our students. African American were 26% of our students in 2018. And then 33% of our students are white in Minneapolis public schools. In 2018, that grew to 36% in 2020. But the orange bar represents the amount of students that were, the percentage of students that made up the population who had some type of consultation or interaction with law enforcement in our schools, so our school resource officers or our SROs. And you can see that the numbers are wildly disproportionate in Minneapolis public schools around who's in the building versus who's actually having interactions with police officers. And so this was a really, really big issue, and this data was being tracked for a long time in Minneapolis public schools. But until the murder of George Floyd at the hands of the police took place, we weren't able to really get police out of schools. Now, there have been a number of high profile issues with police in Minneapolis and murdering Black men, especially in Minneapolis. And so that was when really like a lot of the advocacy started. And over the course of many years after Jamar Clark was killed in Minneapolis and Philando Castile was killed just outside of Minneapolis, there was a real push, including myself with several young people who were saying, we need to end this relationship, or we at least need to reconsider our relationship with police and how we view them in terms of making our students of color especially feel safe, because as you can see, they're targeting our Black and brown students. And so what was really important to me at the time, especially in 2017, is what I said was like, look, we have to at least be able to envision a world where we do not have police in our schools. And so can you all at least make an alternative or a plan around what would a safe school environment look like? What would that need? What needs need to be met that doesn't include a police officer in our buildings every single day, criminalizing our students? And unfortunately, our school board and our leadership decided that that wasn't a priority, and they didn't want to create some type of alternative or plan because they were fine and set with having police in our buildings every single day. But then when the murder of George Floyd took place, after continued advocacy up until that point, that was when they made the decision, hey, we need to remove police officers from our buildings. We need to end this really toxic relationship we have with this partner who does not actually share our values as a school district anymore. The problem is they did not have a very strong plan for what does that look like. And so fortunately, in some cases, there wasn't very many reasons that the pandemic was a fortunate situation. But one thing that it did create was the space over the last year for people to like really weigh in and talk about what this plan would look like. Now that we're back in school, we're still seeing that that plan really wasn't quite sufficient enough to start this new school year. But that was really like the concern of not having a plan. And so, you know, for school administrators, for people, for advocates out there, don't wait till the moment where you absolutely have to make a decision to develop an alternative of what this could look like. Because I think what's really important and something to take away from Minneapolis is to say, like, there has to be a plan still. Like, we still need to keep, you know, the most valuable assets in our community safe, and that's our students and our kids. And at the same time, we have to make sure that we really understand that safety, there's a lot of different perspectives when it comes to safety, and police doesn't equal safety to so many of our communities today. The last thing that I want to share just really briefly is this other piece of data, and then I'll kick it over to Jazz, is the suspension data. And so the suspension data, as you can see, very, very closely mimics and is essentially, you could essentially duplicate this data to recreate the previous slide that I showed you. And so what I want to show you this because it's not just about removing police officers from our school buildings. It's about ending this culture of over-policing and policing the Black, Brown, and Indigenous bodies in our school buildings every single day. In Minneapolis, and you know, this is a trend across the country, we have an overwhelming amount of white teachers in our school buildings, in front of our classrooms, teaching in, you know, global majority school buildings. And what is happening is we see there's a lot of fear of our students. There's a lot of misunderstanding of our students of color. And so we need to not only just say like, oh, let's remove police officers from our building and that'll answer all of our problems. But really we need to say like, what are we doing to really change and shift our culture so that we do not continue to over police and surveil our Black, Brown, and Indigenous students especially. And so that's what I wanted to end with. While we have removed police officers from our buildings in Minneapolis public schools, you know, there's still so much more work to do in terms of the surveillance and policing culture of Black, Brown, and Indigenous bodies. And so, Jasmine, I'll kick it over to you.
Well, thank you so much, Kenneth, for the amazing analysis that you gave. Want to first acknowledge NJJN for hosting this timely conversation and really bringing all of us together. And so again, my name is Jasmine Delafosse. I'm the senior regional organizer with the Gathering for Justice, serving as serving in California. Our organization was founded 16 years ago by Mr. Harry Belafonte after witnessing a 5-year-old Black girl by the name of Jaisha Scott, who was being arrested and handcuffed for being unruly. And now our organization is led by Carmen Perez as we continue our mission to end youth and child incarceration. First, I want to acknowledge also all the students in my community and across this country who have been harmed and directly impacted by the violence of policing in our school system that is doing exactly what it was built to do. I also want to take the moment to pause and really acknowledge the incident that happened in Long Beach Unified, where a young 18-year-old young woman was shot and killed, was shot on September 17th from a Long Beach Unified safety officer in California and was on life support and later pronounced dead. And so this conversation around what policing and safety looks like in schools, we must recognize that that young people and students are being harmed every single day. And in my community where I grew up in Stockton, California, we still have young people being arrested and handcuffed and criminalized in our schools every single day. And so like many of you who have been probably in this fight and collective fight to end police in schools and the criminalization of young people, you know, and like was mentioned earlier, we saw that in 2020, we've seen this uprise across this country, and we have made great strides. However, we must be organized and involved to ensure that those who had boots on the ground before continue to be supported and invested in, because what we are seeing happening this year is that there's also a co-op and movement to also disrupt the organizing that has been happening around police-free schools. As people are changing the narratives of what this looks like and what it feels like, it's important that we continue to ground ourselves with those who've been on the ground and those directly impacted. So first, I just want to say a lot of what I wanted to share is about our recent report that we had released in August with the ACLU of the ACLU of California, who released a report that featured some of our work in Stockton, California, which I'll share in the chat a little later. And so in our report, we address really the over-policing in schools and how this is shown up. So just for context and a snapshot of Stockton Unified, which is a case study I want to share a little bit about, is that we are a school district made up of 40,000 school districts, 40,000 students, and we are one of 21 school districts across California who has a school-funded police department. I'm sorry if my internet is going out. It sounds like there's an echo. And in 2015, according to a report that we had worked with CJCJ, we knew that Stockton Unified had arrested 1,500 children. Nearly 22% of those children were cited with felonies and were reprimanded with misdemeanors as well. We were one of 2 cities in the state of California who had the highest arrest compared to any other city in the state of California. And then so with that, through our work, we've been able to mobilize where we were able to have a settlement agreement with the Department of Justice that found increasing disproportionate rates of students who were being expelled, suspended, pushed out of schools, arrested and cited for low-level offenses or for offenses that should have never been cited for to begin with. And so in 2019, a part of our settlement agreement was to monitor our school district to reform its policies around policing and trauma. And through that, we found in our report that nearly 66%, because of that, we received data of school site arrest. And what we found in our data after COVID, during the year of COVID, was that nearly 66% of our calls for assistance from police in Stockton Unified were welfare checks, 5150 calls that led to police doing home visits to students who had calls for assistance regarding that. And so what we realized through our data after being able to receive it, thanks to our settlement to the DOJ, we recognized that students were being criminalized for having mental health support needs. And so, like I mentioned, 66% of the calls for services that were made were to go to students' homes. And what we know is incredibly important is that law enforcement are not the right ones who are the ones to respond to crises, are the best fit to respond to mental health crises. And I know that Whitney and folks are going to be jumping to that later. And so again, this is just really the tip of the iceberg when it comes to the horrifying data that our students have experienced of systemic racism and violence and trauma at the hands of our school district police. And so what I also wanted to talk about is that in our report, you'll find that our the expulsion and suspension rates of police, even this year, have been all cited mostly by police or have been cited by our police officers that have led to an increasing number of young people being impacted by the juvenile justice system. And so while we know that our student interactions with school police, 41% of our student arrests were for, like I mentioned, low-level incidences for disturbing the peace, truancy, curfew violations. And of all of those students, Black students were over 3 times more likely than any other student group in our school district to be arrested and cited for vague offenses such as disturbing the peace. And we're given court dates to go to hearings like this. And this is, I'm talking about data in 2019-20. And so, and again, our student population showed over 4 times Native American students were being also overrepresented in our bookings and sightings compared to their enrollment, which you will see in our report through the ACLU, which I will share share in just a minute. And so to our recommendations of what we have been working on is really to say that we've demanded that our school district invest in hiring, or 1, stopping the police department's funding, not suspending or expelling students who are not meeting grade level, low level standards for literacy. We've been requiring school districts to have district-wide trainings to enhance cultural competency to combat the implicit biases that are happening in schools. We've been working to change its policies to ensure that there's limited interactions with police, such as questioning or arresting a student at school that possesses a legal warrant supported by probable cause, that students possess imminent danger or serious or physical injury or death to a person on a school property. Because many of us know that students on campus can be interviewed, interrogated without the presence of a parent, without parents being notified. And so one of our demands have really been to change those policies and practices happening in California schools. We know that in Stockton Unified, our child welfare institution codes, we were asked, which will state that the prior custodial 17-year-olds will have the right to consult with legal counsel before being interviewed by law enforcement. So these are some of the recommendations and policies that we've been trying to fight for and push for here in California. And so I'll stop there. I know we're at time, but I wanted to just acknowledge that there have been many partners leading really and championing some of these fights in Stockton, even through the Gathering for Justice, to really ensure that we have strong policies and protocols to really limit the way that law enforcement is interacting in our schools. And so those are some of the campaigns and ways that we've been really trying to dismantle police-free schools in our school district. And in California, we've seen that we haven't all gone there, but we're getting closer to removing the presence and investments in schools. And so I'll stop there and pass it back to, I believe, Melissa or.
Yeah, thanks, Jasmine and Kenneth. You guys are fantastic. And honestly, it's been so encouraging to see the momentum for Rise for Police-Free Schools after, as you guys said, there's been a fight for decades, right, to make sure children are actually safe in school, but with building mental health supports and other resources children need. So it's great to sort of hear how that landscape is changing and how you guys have been leading the way. So thanks for your leadership. We sort of wanted to round out today's conversation by shifting to talking about the need to invest in mental health resources, given that there's been such a focus from all of our presenters about talking about how this is a way we can decriminalize childhood. And so I'm again going to attempt to remove these spotlights and get it up for Whitney so she can round us out by talking about the work to really invest in mental health resources for youth. So hopefully, oh, I didn't do it quite right, but we're getting there.
Hi, everyone. Thank you all for having me. I appreciate NJJN calling on me to present at this beautiful workshop. I have been listening and I'm like, wow, how interconnected are these systems and the way that they function and how they should, in the ways that we're advocating for them to function in the future. And so I am so appreciative to be here to talk about the work that I've been working on. And that's really youth mobile response. I'm not sure if y'all are familiar with 988, which was the National Suicide Hotline Designation Act that was passed at the end of 2020 last year. So I'm just gonna share my screen really quickly. Okay, And so with that work, as much as everybody else has said, a lot of this work was born out of, well, the police-free schools have been going on for decades, but a lot of the work and a lot of the outcomes that you have seen have started to be, have started to come out of what happened in 2020 with the murder of George Floyd by police, and that movement started to drive a lot of things. And then the National Suicide Hotline Designation Act started to really take momentum, and then got passed at December 2020, which basically allocates 988 as the number, or designate 988 as the number for mental health crises, as well as suicide hotline nationally. And as we start to think about what that looks like, we start to think about what are other services that should be tied to those, to that number. And so we think about mental health supports and what that looks like, and how do we kind of defer or deter police from answering those calls, because as Jasmine pointed out in her talk, is that police are not equipped to deal with mental health crises, let alone be the one to respond on a scene. Because normally what happens is you see young people being fatally shot and killed, but also criminalized for all of for their mental health symptoms and their conditions. And so this work, Youth Mobile Response and Investment to Decriminalize Mental Health, was born out of a lot of things, but more specifically in response to the moment of what was happening now. And so some of the things that we know is before the pandemic, even in 2018, there were 1.1 million youth who had unmet mental health needs. And then what we see now during the pandemic, or right up into 2020, right before 2021, was there was nearly 2 in 3 young people who expressed that they were feeling down, depressed, or hopeless. When we look at the numbers now, because someone on my team have run the numbers now, there's about 5.5 million young people who have unmet mental health needs. And that's a lot of young people considering. And then on top of that, there's also a lot of adults who are also having unmet mental health needs. And what we know about young people who do not have their mental health needs met, whether in their communities or in schools, because we know there's a lack of mental health resources in schools as well. We know that the first encounter that they have with mental health supports is usually in the criminal legal system, or through law enforcement, which is also a problem. And so we want to figure out ways how to really deter that and try to get mental health supports and meet young people where they are. And so we started to look at alternatives, and one of them was mobile response. Mobile response is, you might have seen the term mobile crisis and mobile response. I just skipped over that slide because I feel like everybody else have covered all of the data and statistics that we need to know about what's happening with police encounter young people and what happens. So that slide was just basically giving all of the statistics that you've heard from the other presenters. But we're really talking about the difference between mobile crisis and mobile response. So when we think about mobile crisis, we're thinking about like a service that really provides 24-hour rapid service for people who are experiencing acute mental health diagnosis. But when we think about mobile response, and this is a term that we use, we talk about all those other things that people have mentioned in their talks before, not just anyone with acute mental health diagnosis, but people who are also experiencing traumatic events, heightened emotional symptoms, people who might have behavior issues or have some behavior things that's happening in schools and classes. So a place for teachers to call if there's not any mental health supports in their school buildings and things of that nature. And so throughout this talk, you'll hear me say mobile response, because for me, it's more inclusive to include all of the social as well as mental health crises that young people face. It also, the way one of our partners defined it was, we allowed the client to define the crisis for themselves. So it doesn't tell young people what their crisis is, but it asks them, what is your crisis? And they allow them to define it for themselves. And so we try to use the term mobile response so that it can encapsulate all of the things that everyone has already been mentioning about where mental health resources need to be and how they should be used. And so when we think about school, when we think about in their communities, And this is a way that we can get quick access to mental health support. So there are a number of types as this works really start to gain momentum. There's a lot of ways that people have been talking about mobile response and what it should look like. And so one of the ones is co-responder models, which we have seen a lot of attention on, which is a mental health profession with law enforcement. We have also seen first responder models, which is a crisis responder with an EMT or a nurse. And then we have seen a crisis response model, which is with 2 clinicians. And so I really want to exit this out because as we have heard from everyone, and as we probably know on this call, police officers in no capacity are equipped to handle mental health crises at all. And so they should not be on the scene. There are trained professionals who are able to do this work. And this is what we're going to talk about. There are 3 communities that we talk to who currently have these 2 different types of models where they're responding without police to young people needs in their communities. And so when we think about mobile response, we do not need police involved. We just need the mental health professionals that are available to help them, as well as peer support specialists, which are people with lived experience who have experienced similar things as the people that they're working with, and are able to provide them with services that will de-escalate as well as help them out of their situation, probably even better than someone with a degree would. And so when I talk about mobile response, I'm thinking about 3 states. So Connecticut is one of them. Connecticut is a statewide mobile crisis system housed in their Department of Children and Families. They serve youth up to the age of 21 statewide. And the unique thing about Connecticut right now, prior to the 988 number being established, they use their 211 as a point of entry to avoid having contact with police on the scene. And so young people across the state are able to dial 211 and get access to their mobile response team, where their mobile response team will respond to them anywhere in the state, wherever they are, in under an hour. And they have a 90% mobility rate, which means that 90% of the time their crises workers are meeting young people where they are. Another cool thing about Connecticut is, to touch on the point about Jasmine and schools, is that their mobile crisis, also Connecticut created a law that basically connected their mobile crisis teams or mobile response teams to their schools, which allows schools to actually call mobile response when they need support on the scene, and they actually go to the scene. They also have a school diversion program, which is where they actually looked at the numbers and saw that a lot of young people, especially Black and brown young people, were not using the services, for one. And those were the same young people that were disproportionately represented in their juvenile justice system. And they knew that there was a school to prison pipeline. So what they did was they created an initiative, and the schools with that had the most number of young people being referred to the criminal justice system. And they basically created the school initiative where they substituted school resource officers for mental health professionals. And they saw a decrease, 100% decrease in of students being referred to the criminal legal system or juvenile justice for supports, as well as being criminalized for their mental health in one of their schools. And they're seeing a lot more positive outcomes in about 4 other schools that they're serving in their state. The last thing is that they are actively trying to rename their mobile crisis service to mobile response, for the simple reason that I stated in the beginning, was because mobile response is more inclusive, that will let them, or will basically allow them to serve many people with a number of different crises, not just ones with acute mental health diagnosis. Another state that we talked to was Oklahoma. They are really cool because they already use their state suicide prevention hotline as a point of entry to avoid contacting, having young people contact the police. They also serve young people up to the age of 25. This is probably the state that has the highest range of young people that they serve up to, but they also do not respond with the police. They usually respond on their own. Their mobility rate is a little bit higher because they are a statewide system, but they also And so their state is a little bit bigger. So they have a response rate that is a little bit higher, but they also focus on follow-up. So a lot of time mobile response can be a one and done situation and a person will have to call back. Well, Oklahoma, on the other hand, they are one that continues to follow up with the young person even after they have seen them. And so they do a stabilization service as well. And so what that means is after they've seen them one time, they will then follow up with them to make sure that they're still stabilized even after a week or so. And then the young person could continue to make contact with them if they want to, or the case manager that they have, and then they could come back. And then they focus on de-escalate the crisis, prevent hospitalization, homelessness, as well as detention. And then the last model that I talk about is CAHOOTS, which is a national model many people may have heard of. CAHOOTS have been featured in many news outlets as well as in many news articles because of their model, especially after the call for defunding the police, because this is a model that's working out in Oregon. They are a little different than both of the other models. One, they are not a youth-focused model. And two, they are not statewide. They only are located in two localities, which is Eugene and Springfield, Oregon. And the reason why I decided to highlight this model is because one, they are already doing this and they need to be scaled up in a way that is effective across the nation. Two, because they are connected to the police in some way. They get a lot of their funding from police, from the police budget. And the way that people access their services is through 911, as well as their non-emergency 911 hotline. And I mention this is because when I asked them and I talked to them about this, they were like, well, we also realized that people of color and young people of color are not using our service in the way that we would have hoped that they would. Because we are connected to police, and we know that Black and brown youth do not trust, and Black and brown people do not trust the police. And so we're actively trying to disassociate ourselves from police because we know that they are causing more harm than they're doing good, and that people trust our services, but some communities will not trust us as long as we're connected to them. And so they're actively trying to disassociate themselves from the police. But the one thing is that the one thing that's really cool about CAHOOTS is, as well as that they respond with an EMT model, or a nurse. So they use this CAHOOTS van, but they have a medic who is also trained in mobile response and mobile crisis to de-escalate and to stabilize someone. But they do it with an EMT, and so everybody on the scene is also is all trained. But also they do not have, like, everybody on their team is not particularly trained in or got a master's degree or bachelor's degree in psychology or social work, but some of their people just have lived experience, and that is something that they have been found very successful in their program. And I think that's really cool, because these are ways that we can kind of build building blocks for people to get involved in mental health professions without having to go get a costly degree, but only have lived experience. And I think that's really cool. And so CAHOOTS also realized that they are not a young person model. And so I asked them about what are they doing to kind of relegate that. They are currently also working in schools because they realized that there is an under-resourcing in their schools for mental health professionals. And so once a week, they go to different high schools in those different localities, and they spend time with the young people who need mental health services at those schools. They say on a regular basis, about 10% of their calls is young people, and they serve them just as much. The one thing that they outlined, and all of these systems outlined, was basically that we know that mental health profession, like mental health resources, are needed across the country, but they are not, like, mobile response will not be the panacea for relegating calls. And so just asking for more services beyond mobile response, but actually thinking about quality education, employment, and all of those things to really meet the needs of young people. I think I'm going over time, so. And so, yeah, and so then the one last thing I will mention is some things that you all could do. There are many different states that are in the midst of really implementing their 988 systems. There are some states that have already passed it to ensure that 988 is up and running for all for their state. And they are currently trying to connect their mobile crisis and crisis teams to the 988 number. But some things that you all can do is to ensure that your 988s or your 988 system and your mobile crisis system do not have police connected to it, because as we have mentioned throughout this presentation, that they are more harmful and more dangerous than helpful. But to also advocate for peer support specialists as well. And then these are also some different mobile response or crisis legislation. So if you are familiar with some of these things and you are a federal advocate, also be on the lookout to advocate for these things. One of them is the People's Response Act, which was introduced by Cori Bush, which gets into a plethora of different interventions that can really deter and to take police out of the equation altogether when it comes to a number of crises, including sexual assault, including domestic violence, as well as violence prevention and other things. And so I'll just stop there for any questions, because I know I ran over, but if you have any questions, please feel free to contact me.
Yeah, that's so great. Thank you for rounding us out, Whitney. And thank you for ending with federal actions. I think really we wanted Youth Justice Action Month to focus on just that and really make sure that we're highlighting actions folks can take as well, in addition just to sort of highlighting the broader issues at stake. And so, you know, states have really been leading the way, which is why we highlighted so much of the great campaigns on the state level, but we did want to underscore some federal action folks could take. So I know Melissa, my colleagues on the line, with a few additional federal pieces that we were going to ask folks to sort of step up and support. So Melissa, do you want to jump in?
Yes. Hey there. So I'm just putting a few in there. One is an action alert for 3 federal bills we've been working a lot on, one of which would raise the age for federal juvenile court jurisdiction to 12 years old. And the 3 of them combined would do a lot of beneficial things for kids, including getting rid of juvenile life without parole and so forth. So I'm putting that in. And then next is, so the first is an action alert, and the next is a sign-on letter for these 3 bills. And that's an organizational sign-on. So the letter is linked there, and then you can email James Dold at Human Rights for Kids, who's taking more sign-ons for it. And then finally, there's a great federal bill called the Counseling, Not Criminalization in Schools Act that would help to remove police officers from schools. And there's an organizational sign-on there. And with that one, there's also an individual sign-on. So I'll just put that in there as well. So a lot of great actions to take, and I hope folks will consider that.
And I know folks have been super patient, and I'm sure you have burning questions. We had hoped to do breakouts, but with 10 minutes left, I think it's probably better use of our time just to post questions in the chat, and we can respond to them and have the different experts jump in just so that we can get to everybody's questions. So please jump in. I know a couple questions have broadly come up just in terms of housekeeping, so I'm happy to answer those. But I know folks have asked for both the recording of today's webinar as well as the different presentations through PowerPoint. And Louise, I saw you also ask about the actions folks can take. So we'll be sure to share out an email in the coming days. It'll take us a little bit to get the recording together. But we'll share out the email with the recording as well as the PowerPoint presentations and all of the federal asks for folks to take action. What other questions popped up for folks as you were listening to the presenters? Please either, I think you can raise your hand in this. If not, just pop them in the chat and we can call on you and unmute you. Y'all went quiet.
I have a quick question.
Yeah.
Sorry. Hi, everyone. My name is Kimberly. So I'm a student. I'm at a community college right now. I guess my question was like, how do you suggest I get more involved in like this movement and reaching out to other organizations and networks? I actually started a juvenile justice reform club on my campus. And with the help of a professor, we actually started an academic program at our local juvenile detention center. So we're actually giving them a college education, and we want to implement a whole associate's degree eventually. But I guess, like I said, my question was like, how do you suggest I bring more awareness to my campus and to my community, and how to get more involved?
So I'm going to jump in from NJDN, but please, I hope our speakers will also jump in. I think, so at NJDN, we have members all across the country that are working on different advocacy at the state level, which is where most youth justice policy is set. And so you can find an organization in your particular state or jurisdiction and get a better sense of what state laws are being pushed to really protect young people in your particular area. So some of today's speakers were our members who are working on that. So that might be a good place to start, just to get a sense of what is happening on the state level that you could sort of mobilize your campus around. I think a lot of the presenters highlighted different federal policies you could also sort of work to mobilize your campus around, which are also good actions, but I don't know if some of our other speakers want to jump in and share alternative ideas.
Thank you so much. I appreciate it.
Yeah, I think the other thing which we always welcome to is, so we do have an option to become an NJDN ally. And so with that, if you wanted to connect and share information about like your school group, we're happy to share different actions as they pop up. And we have different events throughout the year. So I want to share that too. And yes, what Alex said in the comments is kudos for everything you are doing to rally young people in your jurisdiction. It looks like there's another question. What steps were initiated to begin the process and conversations of removing law enforcement from schools? They're from Missouri. So I don't know, Kenneth or Jasmine, do you want to respond to sort of what the first steps you took?
Yeah, sure. Thanks for asking. So some of the first steps that we took were, I think one is like identifying, is this something that you have a base of people that really like support and really want to get police out of schools? I think, you can only go so far as, people actually want you to. So I think, connecting with parents, connecting with students, and then looking at, all of the policies attached to it were something that we really dug into. So we first looked at statewide policy, and it was clear to us that there was no statewide policy that required there to be police in schools. And there was like very little statewide policy that was in place to like have any type of criteria for officers to be in schools, or any type of qualifications, any type of restrictions on what they could or could not do. And so that was a real eye-opener for us. And then, if you want to take action at your local district, I think looking into like the actual contract language between your local school district and your local police department. So those are steps that we took, and really understanding and learning like how much money is being paid, what are the terms that that the contract could be ended, how long is the contract, and when it's time for renewal, what are the opportunities to either get people to say yes or no around whether they want to renew or not. What I will say is the thing that really, well, obviously the murder of George Floyd was a very, very big moment here locally for us. But the thing that really got the board to start going down that path was when the board made the decision to actually when their school board made the decision to end the relationship between the Minneapolis Public Schools and the Minneapolis Police Department. It wasn't because police no longer could keep students safe in our buildings. It was because they felt like the police department's values were no longer aligned with the school district's values. And so when that ended, and when we were able to really visibly demonstrate that before George Floyd's murder came to even was a part of the conversation, that's what made them really start to reconsider, wait, this isn't just about safety, this is about who we decide we actually want to be in our students' lives. And so that was a really big kind of conversation or narrative shift that was important for the ultimate decision that the school district made.
Thanks so much. And it looks like Beatrice is also raising her hand. Do you want to jump in?
Yeah, thanks. I'm just curious I'm with Moms Rising. I'm the National Director of Youth and Family Justice, although I'm based in Chicago and have been participating and supporting a lot of the Cops Out of CPS and defund campaign work here. I'm curious if in other places where folks on this call are doing work around police-free schools, if they're having issues with some of these behind closed door contract negotiations and how they're navigating that against a backdrop of what I think is us essentially losing this narrative war on both, at the highest levels, right? Like with this kind of summer of violence and, all the kids are carjacking and all this stuff that doesn't seem to be interrogated in a deeper level. But for example, here in Chicago, the defund and Cops Out of CPS campaign has been pushing pretty heavily to be involved in contract negotiations. But as of recent, the mayor essentially had closed door negotiations with the FOP for the contract, and now it's renewed for another 8 years. And so that's 8 years of essentially being sort of powerless, right? And leading up to that, we were told that nothing could happen until the new contract negotiation happened. And then when it did happen, we were essentially shut out from it. So I'm curious, with both, how people are navigating some of the kind of media onslaught that's kind of painting this picture of rampant crime and violence that kind of gives the perception that there's a need to kind of increase police presence both in schools and in our communities, while also trying to push for these alternatives. Because I think depending on what municipality you're in, these contract conversations are either accessible or they're not. And that's been, I think, one of the main ways that I've been hearing folks organized. So I'm really curious how other people are kind of navigating both these contract conversations, but also the backdrop of media narrative that is essentially, without explicitly being pro-police, is really pushing a narrative that to me implies a desire to have more police as opposed to really shedding light on these alternatives. And just thank you to Whitney for that presentation and being able to see the different groups across the country and how those rollouts are happening, because I think it's really helpful understanding the mechanics of those programs and what's working and how people can support.
Yeah, I'm not sure if any of our specific presenters wanted to speak to the police contracting process. I will, hopefully folks will jump in. I'll just say in terms of the media piece, I think that's something we've seen in numerous jurisdictions, right? That particularly, I know you elevated the issue of car thefts. It seems to go viral across states every summer. And so NJDN is doing a media education series in partnership with some of our other national groups. So we're hoping and actively recruiting different reporters to really hear from different data experts like the Pew Charitable Trusts and others on how, these sort of blips that come up in the media are just that, they're blips in sort of this larger, I don't know, I don't have the language, but right, the sea of data that exists that really says that we are the safest we've ever been, that kids are not violent, that kids are just being kids. And so we're hoping to get that message out there, because I hear you, we've been combating it, and it seems like in every state. I wish I had good advice on the contract piece, but I'm hoping some of our presenters, maybe Kenneth or Jasmine, or I know Louise has been doing some of this work too, might have advice on police contracts.
I think Jasmine had to drop off. So Kenneth might have some insights on this too, but also Beatriz, if you send me your email, I know Jasmine did, I believe, do some work on this in Stockton and had some issues, where they worked with the FOP. So I'm happy to connect you guys. Kenneth, do you have anything else you wanted to add?
Yeah, I guess the only thing that I would share, one, I want to acknowledge that the politics of Chicago are going to be much different than the politics of Minneapolis. So I don't want to, oversimplify this at all. But, the contract negotiations in Minneapolis with the police department were also private. We did not get access to them. And so we just brought the issue to the public in whatever venue that we could. And we were trying to, negotiate points of the contract in public. So again, I think understanding that contract is really important. One of the things that we continually asked the school board here locally, publicly, was to say, hey, why do you feel like you need them? And they would say to keep our students safe. But what was happening was we only had officers in our high schools and not in our elementary schools. So one, why do you feel like our high schools need to have officers and need that type of protection, but our elementary students don't need that type of protection? And so really this isn't about keeping students safe. This is about keeping some of our teachers safe, maybe, or like the perception of safety. And you are, protecting whom from whom, right? And so I think that was a really important point for us to really drive home publicly, was, the money that was going into the contract, some of the cognitive dissonance around the messaging that they're putting out there around why they needed it versus how they were actually using it. And so, yeah, that was just one tactic that we took, was whatever public venue, whether it's a city council meeting, school board meeting, whatever it was, we were trying to really just negotiate that, bring it out to the public and say hey, public, you need to know the details of this, and does this make sense to you? And then bring it directly to our school board members, which were to say hey, does any of this make sense? So we were just trying to negotiate it publicly, because yeah, we didn't have access to it privately.
Well, thank you all. It looks like somebody just posted a comment too. So we'll do this one last question, and then I know we're over time, so I want to be respectful, but I know there was a question about Missouri recently raised the age to 17, and some of the panels spoke about issues facing juvenile justice. What are the best steps to now support an older population that now falls under juvenile justice? So actually, that's a perfect segue. So next week, we're actually having a conversation all about this. And so not to cut you short, we'll be following up with you with different resources, but we're having different conversations each week. Today was really about the front end of the system and putting in barriers to protect kids from even coming into contact. And next week, we'll be talking about making sure no young person has ever tried as an adult, and trying to walk back all of those policies that we know came out of the super predator era. So I'm going to hold your question for next week. We'll send you lots of resources on it, but great question and perfect timing. So we will follow up. Again, thank you to all of our presenters. You've been amazing, and really appreciate all the work that you're doing in your jurisdictions as well. Melissa, was there anything else you wanted to say that I missed?
No, just also wanted to express my thanks. I really greatly appreciate all of our presenters and their generous sharing of their time, and all the participants. Thank you for making this a wonderful time together. So I hope you'll join us for our future presentations this month.
Thank you all.